If you're watching this video, I hope that you're coming from part 1 of the discussion that I already started about water birth and even laboring in the water. This video is part 2, so please stop it if you've not seen part 1 and go there. I'll link it here so you can access it. In part 2, we're going to see a bit more about water births, like cons for you and baby, and when it is the best moment to use the element in your favor for your labor and birth. Let's start. Hello everyone and welcome back to my channel. If you don't know me already, my name is Ilenia, I'm a midwife. I have been doing YouTube videos now for more than a year, but I've been a midwife for way longer. It's been over 7 years now. If you want to follow me on Instagram, also you can find me on Bump to Baby Official, and you can see some posts and some spoilers or some videos that I put out every week. Now let's keep talking about water births. And why would you choose to have one for you? We were talking about cons of water birth, and we discussed about why one might be the best choice for you as a mom. But let's see what it might be the risks or the cons for your baby. There are many, first of all, to reassure you, and the ones that there are very extremely rare. For example, let's talk about cord snapping. The possibility of the cord rupturing basically, and this can happen if, for example, your cord is too short, and then by you pulling or the midwife pulling the baby out of the water, this snaps, and therefore this is an emergency because obviously the umbilical cord contains vessels and therefore it contains blood, and it's important that blood goes to the baby and not wasted, and that baby doesn't lose more than it should be at all. So that's very rare, and if this is the case, the midwife might ask you to just simply stand up and bring baby to the surface and then maybe clamp and cut and the cord, and then that's absolutely fine. So it's very rare. I've never seen it in my career so far, and I hope I don't, but just to let you understand that I do water births often, and that never happened to me either actually in water nor on land. Another con for baby might be, and this is a little bit more borderline in a gray area, the topic of infection. We don't know if infections are spread more in water or quicker, or if you have a bacteria called maybe like group B strep or something else that you don't know, then it will definitely go into baby because he or she was born in the water. We don't know. Some studies say actually it doesn't, but we don't know for sure. What really we need to make sure, though, to prevent and reduce the risk of infection is that the tub is cleaned properly every use, and that's why you should ask your hospital to provide you some protocols to tell you what they do to clean their tubs, because it's very important that not only the tub is clean but also the jets where the water is coming from, and that there is a rigorous and methodical cleaning between patients, because that's also like an increased risk factor of infections if the tub is not cleaned properly. And that links me to the fact that, to be honest, the inflatable tubs that your midwife brings for your labor at home, or even your own tub, sometimes can be even safer because you know that they're clean, and you know, especially if you know that the pipes are clean and safe, then you're fine that the water is not carrying any bacteria or any potentially harmful virus for your baby. Do babies drown in the water? You might be wondering if this is a risk for your baby to inhale and drink water and therefore not being able to breathe. I have a good news for you. No, they don't. They are equipped with a reflex that is called the dive reflex that will prevent them to start breathing. Until this part of their body does not reach to the surface, they're not stimulated to breathe. Their lungs have been silent in the intrauterine life. They are pretty much ready to work, they know what to do, but as soon as they hit the air and the oxygen, then a lot happens in the fetal circulation that I'm not going to explain now. It's quite complex and you don't want to hear it, but then they will obviously breathe. So baby potentially can be left in the water submerged for a few seconds and nothing happens. They're not going to breathe or inhale water. That's why also you see newborn in the pool taking swim class, let's say that, because they have this reflex and their instinct is that they don't have to breathe in the water. And think about it, they are in the water, they're grown and develop in the water for 9 months. So it's actually the same environment, and that also explains why it takes a little bit longer for them to breathe when they're out and nothing happens. Your midwife is able to determine if that is an emergency situation and that your baby needs some help to breathe, or if simple, some gentle transition to the extrauterine life. Also, they're still attached to the cord, so they have plenty of blood giving them a lot of oxygen, and they are absolutely fine, and also actually reduces the stress of being born, let's say that. I will totally say that, because that's actually a traumatic event to be born, and therefore why would you not want to do it nice and gentle with more than one source of life? So meaning your lungs that are starting to work outside in the air, your cord being attached, and you just simply go from an environment that is very similar to another that is quite similar to the one you were in before. I think I covered pretty much everything in terms of laboring and birthing in the water. Actually, those two are quite two different things. Some hospitals allow you, and I hate to say this word, but their protocol is just that you can labor in the water and then you have to get out for the birth, and others are actually ready, and the staff is medically trained to also help delivery and births in the water. Remember that you can do whatever you want, so if they tell you that you have to get out and you don't want to, you can say no, but also be rational and understand that if there is an emergency and the situation changes, then it's definitely a good idea for you and your baby to get out of the water for safety reasons. But otherwise, when and how and who can go in the water? Well, when, I would say the best time to go in the water is when you are in established labor. Doesn't matter how many centimeters you are though. Like if you feel that you want to go in the water and you really crave the water, you will want to go in the water, then just go in the water. If you're at home, for example, and you don't know whether to call your midwife or go to the hospital, and that's the test of the water is a good one to do. You can go and use the shower or the tub if you have it, and then if your contractions slow down after you had a bath or a shower, then probably is not the best time to go to the hospital or to call your midwife yet. While if after the bath your contractions are even more strong and regular, then that's a good sign. Why? Because the water relaxes you, and it can be a aid for your labor or it can go against your labor. If it's not the time, if you're in prodromal labor or early labor, usually the fact that you're relaxed, it will just slow down or stop your labor. While if you're in established labor, usually it makes the labor go even faster, as we were saying in the first part. It can be a pro of laboring and birthing in the water. How long can you stay in the water? How long you wish to stay in the water? Usually your midwife will ask you though to get out, I have to say, to wee. It's very important to keep the bladder empty during your labor to make sure that baby is able to go down in the pelvis, and maybe she needs to check your cervical dilatation, and some people do it in the water, some people might be more comfortable to do it out. And also for you, like, it's very important to change the environment. Maybe if you're getting too hot, too warm in the tub, then you just want to get out a little bit, and then if you feel to get back in again, then you can do so. If your midwife obviously asks you to get out the water for emergency, then just listen to her. That's another criteria for someone being able to go in the water, is that you need to get in and out quite quickly. You need to be able to get in and out quickly. Obviously, the floor might be a bit slippery, the tub might be high, so you always have help around. But if the midwife asks you to go out, to get out, then just listen to her and get out, because there is usually a reason why she says so. And trust me, we don't want to get people out the tub if they're nice and comfortable and relaxed and is helping their labor. Your midwife, although might look that she's not doing much, she's doing so many things. Following labor and birth in the water is so tiring for us. She checks the temperature of the water every hour. The water needs to be between usually 36 to 37.5 degrees Celsius, and it's very important that it's checked regularly to make sure that you don't get too cold or too warm. She will check your baby's heart rate every 15 minutes with the Doppler, or every 5 minutes if you are starting to push. Or maybe you're giving birth into a hospital that support labors and births in the water while you are with the telemetry monitor. Is a wireless monitor that can go in the water. Also, for example, if you are medium or high risk, then that's an option, because your baby can be monitored in the water anyway. She's also checking in your vitals, and she makes sure that you eat, as I was saying before, and that everything is going smoothly. Your birth partner as well has a very important role when you're in the water. He or she needs to make sure that you are hydrated, that you can have access to drinks like isotonic drinks or even water. During your labor in the water, it's easy to lose energy or to sweat a bit, so it's very important that you reintegrate with some energy drink and some snacks and some water constantly. He or she can massage you anyway in the back. Counter pressure can be done in the water. Unfortunately, you cannot have an epidural in the water, but you wouldn't need so if you have an epidural, or you cannot use the TENS machine. You can use the gas and air, the Entonox in the water. Water is such a versatile element that you can use, and don't think about it as a standalone pain relief method, because a lot of things can be done while you're in the water. Your partner can even get in the water, especially if you're birthing in a freestanding unit or at home. You can use aromatherapy, you can use the music, you can change position. That's so important also to aid the process of labor. That will make your labor go faster potentially, and will position baby in a better position. Think about the pelvis as a mobile structure, and your baby navigates through the bones and the muscles in the pelvic area. Therefore, in the water, you can use the buoyancy effect of the water. You feel lighter, you feel better, it's easier to move with your pregnant belly in the water, and therefore the movement is enhanced, and therefore it's easier to labor and birth in the water. You might need to get out to birth the placenta. It depends. Some people and some hospitals are fine with having the placenta be born in the water. Some places prefer you to get out for that part. That's entirely up to you as well, but you'll definitely have plenty of delayed cord clamping when the baby comes out. He or she will be put straight away chest onto your chest, skin to skin, and you can have a few moments in the tub with your baby and your partner while you all adapt to this new big change in your life. And then if something is going on, maybe you're bleeding too much, or maybe your midwife is not comfortable and confident for some reason to have your placenta in the water, then you just get out the pool with your baby and you birth the placenta. That's all for this video. I hope that it was helpful. If you're looking for some evidence around water births, I'll put some links in the description, and as always, make sure to subscribe to the channel, and I'll see you next video. Bye bye.